Thank you. This is a fantastic time for me to understand that the non-communicable disease and the neglected tropical disease are the diseases of the poverty over those both the diseases they create the poverty or it is in a vicious cycle, and the cohesion project has generated uh, enough evidences that we have to work on NCDs as well as the entities together, and these evidences that encourages us to work on this evidence-based or you know this encourages to practice the evidence-based public health practice that is really required for our country, and I'm quite happy that we have enough evidences to practice really, and this cohesion projects that has created an opportunity to work in an integrated approach or a mixed approach, and that really creates a cohesion between these non-communicable diseases and the neglected tropical disease. The evidences from Nepal, Peru, and the Mozambique, what we have listened and discussed, the situations which we are almost the similar kind of situations we have. So this is the time that we have got a lot of evidences that we should work on this NCDs and entities. But it's still we have to discuss further how can we make a real integrated project or integrated approach to address both the problems, non-communicable disease and the neglected tropical disease. I think that's a really a good a start that we have to think on it. I think the policy people, they have to understand in a proper way that with a very minimal effort we can handle this both non-communicable disease and the neglected tropical disease, and it might be a very cost-effective kind of approach, and we can address in a very specific manner both the problems with the very minimal efforts, or that we call the cost-effective efforts. And at the PSC level or the primary healthcare level, definitely we have to work to strengthen the health system there, and we have to train the people who are working there. And also, what I think, like in our context, the health workers who are working in the primary healthcare settings, they have to realize that this is a priority area that we have to address. That is something we have to arrange. And at the community level, most of the communities, they don't know what sort of services we have in the primary healthcare level, and what sort of facilities we have at the primary healthcare level. That's how people they do not go to the public health facilities because they don't know what is there, what is not there, and then most of them they approach to the private service providers, and the services for non-communicable disease as well as the neglected tropical disease and the private services, they are very expensive. That's how they cannot continue the services. So we have to focus on the awareness level where we can get the services. And then another important thing is how can we create or empower the community people to be prevented from non-communicable disease as well as the neglected tropical disease. That's the health promotion aspect that we have to cover. As a member secretary of Nepal Health Research Council and the academician, I can work to make this policymakers kind of realization that we have to invest on non-communicable disease as well as neglected tropical disease in a proper way, that that creates a synergy, and we will get a very good kind of outcomes if we involve, or if we be able to integrate this non-communicable disease and neglected tropical disease into our health systems.